The first meeting I would like to discuss is a meeting which occurred on October 8th at 11 a.m. at Sanford Health in the radiology conference room. I was present at the meeting as a student. Although the information that was discussed actually impacts my current position as a nurse. The name of the group or committee is the Stroke Intervention and Work Group. It is consisted of a variety of members from nursing, administration, and radiology. The purpose of the group is to share new information regarding stroke care in the hospital. This group meets monthly or more frequently if needed if new interventions or protocols are introduced. The meeting was semi-formal with open dialogue amongst the members. However, the stroke coordinator is the head of this committee and started the meeting off with a proposed agenda and a follow-up section where she would address questions that were previously unanswered at the last meeting. I believe the open dialogue of this committee enhanced communication amongst the group members. I believe there was great communication with one another. Each group member would praise another member by bringing up a good point, saying things of, oh yeah, I never thought of that, or yeah, that's a great point. Additionally, no group member was defensive if another group member had a suggestion on how to improve another department's effectiveness. For these reasons, I do not believe that the committee showed any groupthink behaviors, as all members of the committee were able to speak their minds, as well as the group members felt free to question other group decisions. I would have to say if I was to lead this committee, I would try to have a interventional radiologist attend. Many of the questions needed to be asked by the provider, and so the meeting, when I left it, it kind of seemed like not a whole lot got done because the chair still had to get answers from um, the radiologist. So I think they could have improved the productivity by having one available. The second meeting I was involved was a rapid response committee. It's a small subcommittee that was just formed recently. The purpose of this committee is to develop a rapid response protocol to be implemented in the hospital at Sanford Health in Bismarck. I do not regularly attend this meeting, nor am I a part of it. However, as a charge nurse within this organization, this will have a direct impact on my job as a charge. I respond to rapid responses, so it was kind of nice to see what was going on behind closed doors and what was about to come. The meeting had a chairman who addressed previous questions, which they addressed that were unanswered from a previous meeting. The chair would open up with an agenda. After the agenda, the layout was a question and answer format. The chairman would ask the committee members questions, and then the committee would respond with their thoughts and opinions. I think there was great communication amongst all committee members. After the agenda was completed, the chair opened up for any questions or recommendations. I think the chair did a great job addressing each department which was present. That included ICU clinical coordinator, ICU manager, and administration. One area of improvement, I think it would have been helpful to not only have respiratory therapy but also pharmacy within these committees, as all respiratory therapists, there's one that responds to rapid responses, and many of the questions that the committee had involved the medications which were going to be implemented within the protocol. So by having a pharmacist available for this committee, I believe that the meeting would have been more productive. The third meeting which I attended was at the Education Building at Church of Ascension in Bismarck in mid-November. I do not regularly attend these meetings, but as a member of the church, I was allowed to be present. The meeting consisted of 7 board members, as well as the Monsignor, and then several of the parish. I learned that to be on the board, that 5 of the slots are voted on by the parish, and the remaining 2 are directly elected by the priests of the church. The education meeting was open to all parish, and it serves as communication between the parish staff and priests. The goal of the committee is to allow for greater communication amongst the church and identify areas of growth, as well as praising accomplishments within the church. They followed the traditional meeting style, which included an agenda and past minutes. I guess this did not surprise me, as the Monsignor is a former attorney, so he had that background for him to kind of organize the meeting maybe. There was great communication throughout the meeting. I think everyone was treated equally and allowed for ample time for anyone to voice their opinions or concerns regarding the matter. I did not notice I did, however, notice the behavior of herding at this committee. Frequently, when a question would come up, I would see committee members look around at one another, almost to look like they were trying to kind of read the nonverbals from the other committee members to kind of determine what they were thinking in their head before they would actually speak. I think they did this so they wouldn't disagree with one another maybe. Overall, if I would have to lead this committee, I would continue the same framework as the current practice, as I believe it is very inviting and welcoming. However, I believe the committee could benefit by sharing the minutes publicly on the church's website. I believe this would allow for individuals who are unable to attend these meetings, whether that be due to their own schedules or maybe disabilities which prevent them from attending, to gain a greater understanding of what is going behind the scenes at the church. Thanks everyone for listening.